So, good morning, Dr. Ajibike. Thank you so much for joining us for a special Ask the Expert, where we will be focusing on strengthening corporate governance in healthcare. But before we get started, can you tell us a bit more about yourself?
Well, as you said, my name is Ajibike Oyewumi. I am a gynecologist because though I don't practice actively anymore, I still get to hold people's hands and walk them through our healthcare system and sometimes still make prescriptions. So I've kept my license active. I've been practicing healthcare for 33 years. And I've been in the healthcare quality space for the past 15 years. I narrowed down and focused largely on quality in the last 10 years. So that's me. What else would you like to know?
No, that's great. And I also don't want us to forget this important detail that you are a PCC alumna. So thank you for participating in our courses. Yes. And of course, as we go through this interview, we'll talk more about your global and your local experience. So thank you so much.
So I forgot something very important. That you see, that tells you where I'm coming from. I am actually the chief executive officer of my own consulting firm now, which is called Kalitera Q Advisory Services. Kalitera Q. Kalitera is the Greek word for the best. And so I've named this company Kalitera Q because our dream, our goal, our vision is to help organizations pursue and achieve as much as possible the best possible quality that they can deliver to their patients. I started this up only very recently, and I guess that's why I forget, because my mind is so focused on the work that I'm doing. It doesn't matter the vehicle I'm using. But I think I should say that because I'm actually proud that I've been able to take that step. It's been a long time coming, and thank God it has come.
Thank God. Well done. I know based on our interactions and some of the work that you've done to support the HLA, I know that you are a fantastic educator and facilitator. So I can only imagine what Kalitera Q is doing. So well done. I'm happy that you mentioned it. And maybe at the end of this video, you can just let us know where we can find more information. So the website, and if anybody wants to contact you about using your services. So thank you. Let's move on to our topic at hand. And we are talking about corporate clinical governance today. Right. And so corporate clinical governance is a multifaceted term that refers to the processes that seek to hold boards and leaders accountable for continuous improvement of clinical operations and financial performance. In your expert opinion, how would you define corporate clinical governance, and why do you think it's a critical aspect of delivering quality care?
Okay. Corporate clinical governance, or we call it, I'm used to referring to it as clinical governance for short, even though it manages the entire organization, or rather it refers to both clinical and non-clinical. Actually, it's a system through which organizations are held accountable for safeguarding high standards of care and continuously improving the quality of their services. And they do this by creating an environment, in which excellence flourishes. So, it's about creating a culture in an organization where everybody is, the expectation is excellence and everybody's driven towards the excellence. That is not to say it is achieved the first day, but if it's a clear goal, then everybody knows. And that is the way it is the way of the organization. It's not just a part of it, like I like It's the fabric, it's the entire fabric of the organization. So anybody who comes in, you know, knows that this is the way it's done, right? And, you know, I'll clarify something. I don't know if that will be your next question. But you see, when we talk about accountability, because I've been challenged before, when we talk about accountability, it's not about finding bad people. It's not about punishing people for what they do. It's about establishing the right leadership and the right culture, like I said, which are keys to successful organizations. It's about a willingness to self-regulate. You know, that's what the accountability is about, to provide that environment that is open and encourages participation of all staff. It's an environment in which people are willing to see failure. And you don't view failure from the sense of punishment or bad people. You view failure as a system problem, and think in terms of systems and how we fix that system. That means we don't cast blame, even though we do talk of a just blame culture, right? We don't just cast blame once something goes wrong. We understand that oftentimes it's the system that works, that produces the result, right? It says that every system is perfectly designed to get the result it gets. That is part of what clinical governance is about, understanding that the system produces that result, and therefore, working to the leadership, working to build that system. So we actively understand the system. We actively go after failure in the sense that we want to know, you report, you do audits. We want to know what the failures are because you learn. So you become a learning organization, and then you work to correct those failures. Then the other thing I'll clarify is leadership. When you talk about clinical governance, the CEO of the organization and the board are ultimately held accountable, and they are willing to take that responsibility. However, everybody is a leader in one form, shape, or the other. So when we're talking about leadership, we're talking about departmental leaders, we're talking about team leaders, we're talking about shift leaders, we're talking about physicians who are not the natural leads in clinical teams, right? And everybody else just being willing to take ownership of the system and improve it. So, that is what clinical governance is about. Everybody being held accountable for good quality, safe care, efficient care, right? Yeah.
Excellent. I really love a lot of it. I'm sorry, did I cut you off?
No, please go on.
I really love a lot of the things that you just said, and I just want to recap. So you talked about creating an environment which excellence flourishes, and I think that that's really key. If everybody feels that there's a sense of ownership, even from the cleaner to the gate man to the CEO, that we all work together to make sure that the patient has the best experience and the best possible outcomes. We also talked a bit about accountability, and you said something that I really, really think is important, especially in this part of the world, is that making sure that there's not a blame culture. And that a lot of times when there's a failure, it's usually a reflection of the system, right? It's not necessarily, not all the time, but it's not necessarily that the person themselves have failed, but there's a series of things that cause this outcome to happen. And I think that's really, really key, especially here, and I'm sure you can agree, that a lot of times if something happens, it's, oh, you should have done this or you should have done that, as opposed to let's look at this as a learning experience and see what we can do as a whole to correct this. So I think these are really, really key points, and thank you. So I want to move
to say something about that very quickly. It's
sure.
It's you see, I mean, we all grew up like that. We all learned that. That is the environment. That is what we were taught. And so it's not, people don't understand it, is why it still goes on, right? Which is part of why, part of our vision or and our mission in Kalitera Q is to educate people, especially the healthcare professionals, about quality and safety. We're talking about a just blame culture, not a no blame culture. Because yes, we do recognize that there are people who are risky, they take undue risks, even though they know what they're doing is wrong. But 80% of the time, it's the system. But again, we need to teach people. I learned this, it didn't come, it wasn't intuitive, right? So it's part of what we will keep teaching, it's part of what we'll keep talking about, and we hope that the changes will come gradually.
That's a very good point, is that this is something that needs to be learned and it's not intuitive. So as people are listening to this, they shouldn't feel that, oh, how do I not know this? But it's something that you learn, and that comes through exposure, through educating yourself, through webinars, through different courses. So please, it's something that we should all take note of, that you may not inherently know how to do this, but it's something that you can definitely learn. So, Dr. Ajibike, as I mentioned earlier, you have, and you even have said it, you have some substantial experience in driving quality improvement initiatives, both locally and internationally. Can you tell us a bit more about that work and how your approach changes based on the context you're working in?
Okay. So I started out my quality experience here in Nigeria. I can't talk about my quality experience without mentioning my wonderful mentor, her Professor Ade Ilibuti, who introduced us to quality at the time. So I started that off while I was in Lagoon Hospitals, where, quality, I didn't know about the concept of quality. I didn't know it was a thing, right? I didn't know there was a field or, that concept. I just felt that there was, I always felt like there was a way to do things better. And Prof did recognize that. And when he learned about the formal field of quality and learning about it, it was something he introduced us to, and that's how I took off. Now, it was a bit confusing at the time that I started, reading about the different things, quality assurance, standards, quality improvement. I was a very confused human being. But, there's so much I wish I knew back then that would have saved me a lot of headache. But we eventually started out using the Joint Commission International Standards to drive our quality journey. Now, what I realized about that now is there is a difference between what's happening here and what's happening in other climes, especially in the developed countries. So I did practice quality improvement here from about 2005 till I left the country in 2011, and I had the opportunity to work in Ontario, Canada for 6 years. And I worked with the organization, the agency that's charged with overseeing quality for the province of Ontario. Now, the difference is this. When I was in Nigeria, and up till now, even now that I'm back, what we are still trying to do is establish standards, right? There's what you call the Duran trilogy that looks at quality from 3 angles. You have quality planning, which is how you even think about how do we structure quality? How do we establish quality? What do we need to do to establish quality? Which would include thinking about what your standards are, establishing those standards, and then thinking about how to implement the standards, right? Then quality assurance is, now that we have established the standards, how do we know how we're doing? So quality assurance can be like quality control, checking what are we doing? Are we doing it well? Getting audits, are we doing it? Quality improvement is, okay, so all these other things are established, you have your foundation. How do we think about improving on the care that we're delivering? right? So the difference between what I was doing here and what I was doing in Canada and what's rampant there is that here we're still struggling to even decide what the standards are. We're still struggling to establish those standards. So Society for Quality in Healthcare in Nigeria, for instance, has now developed a set of standards which have been internationally accredited. Kudos to the organization. We've established a set of standards that we expect hospitals to meet. These are minimum standards, right? When we meet those minimum standards, we can think about improving on them. Now, in Canada, it was all about quality improvement. They do have an arm that looks at quality assurance, which is their accreditation body, but a lot of things are taken for granted. A lot of things are established. They can't even think about doing it differently because they don't know differently. So what we were doing there was largely running on QI projects. How do we improve time? How do we reduce falls in the elderly? How do we improve immunization rates? How do we improve surgical outcomes? How do we reduce readmissions? Things like that. We were not talking about how do we ensure we have power? How do we ensure we have water? How do we ensure that our professionals are public credentialed and licensed and privileged? We were not talking about all that. There's a step higher. However, having said that, there is a place for both here. You can use quality improvement principles even as you're establishing your standards, right? Because quality improvement principles says when you're doing something better, you don't just jump into it. You think about how do I do it in a way that is sustainable? So you're testing change, you make a change and then you test it and make sure it's fine, and then you test it and make sure it's fine. Oh, this is sustainable, then you lock it down, right? And then, even then, once it becomes standard work, you think about, we can do it better. So good enough is never enough. Good enough is never enough. As they say, good is the enemy of excellence.
Yes, definitely. I like this. And I think you've given us some really important information. So I'm thinking about, I don't want to just say Nigeria, but let's just say, developing countries. There's a reason why, when you're attending these sorts of programs and, listening to different, lectures or webinars, the context is so important, right? Because like what you said, what they may do in the global north may be very different than what they do in the global south. And that doesn't mean that the two can't merge, but it's just to think about where are we right now? So you talked a bit about, Nigeria is still trying to establish standards. And I think that's really, really important. So for, a small private hospital owner that's on, or maybe one of the CMDs that are running one of the general hospitals in, the busiest part of Lagos. And they're listening to this saying, well, that's where we are, trying to establish standards, but still want to make sure that as we establish these things, that there's sustainability. What do you tell them?
Oh, well, I tell them, what I would say to them is seek help, right? So there's help now. When we started out, we had no idea where to go. Here in Nigeria, we tried and we couldn't find anything, and we had to step out of the country to get help. But now help is available. There are quite a few organizations. The Society for Quality in Healthcare in Nigeria is one firmly established one. HLA.
Of course.
Of course. So don't try to do this alone. Two, keep an open mind, be willing to learn, be willing, the leaders need to take ownership. If you do not take ownership of that system and believe in it and drive it, it will not work. Because your people are looking at you. If you're paying lip service to quality, your people will know. And that's exactly how they would do it for you. Everybody will pay lip service to it. So as a leader, you have to be committed. You have to walk the talk. You must be willing to commit to the resources. So quality is not exactly cheap, but I tell you, poor quality is more expensive, is more costly. It may just be that, you know, you are not the one paying for it as the healthcare professional.
Yeah.
Somebody's paying for the poor quality. Because when you have poor quality, you waste people's time. Time is money, even if you're not calculating it. If somebody, imagine, I mean, if you're a government worker, yes, it doesn't matter. You go to work. You don't go to work, but somebody on the other hand, on the other side is paying for it if they don't get the services they need. So if it's a private owner, they can't make money, right? Then they suffer poor health.
Yeah.
Poor health means they can't work. It means their family suffers. Some people pay with their lives. So poor quality is costly. So, you know, good quality is just the natural alternative, is the best alternative. In fact, for me, there's no alternative. So if a leader in an organization sees it like that, then you're willing to make the investments. I am also aware that sometimes it seems like, oh, I don't even have the money to put in, but it's not all about money. Many times processes can, how do you call it now, be an alternative for structure. So yes, I mean, there are basic things. If you don't have water, there's no way you can deliver good care. In fact, ideally, you should not even have a license if you don't have water, right? So, but when you are willing, when there's a willingness to improve quality, you will find a way, and it's not necessarily the costly way. Meanwhile, if you begin to deliver good quality, even though you may say that your clients can't define it, when they see good quality, they know it. So you begin to get more footfalls, and then you begin to see your returns on investment. It's just that willingness to step back and say, okay, this is it. And then we do have a moral obligation, really and truly, to deliver good quality care. We all swore, we all put up our hands and swore that I will do no harm.
That's right.
You know, and I feel sad that not all of us, I mean, we have really fantastic people, really fantastic healthcare professionals out there. So the few bad eggs that are there, or that are just not willing to do what they need to do, you know, kind of smear it all for, you know, for all of us, you know. So apart from that, of course, establishing a culture. Quality is not a department. It's not a department. The fact that you have a quality department doesn't mean you're doing quality. Until it becomes embedded in the fabric of your organization, until it becomes a way of life for everybody, you are not doing quality. You may see that, oh, things seem to happen, you get a certificate or an accreditation, but your clients will be able to tell that you are not doing quality well, you know. So you have to think about that, you know, establishing. So of course, the investment involves education, right? We have to educate ourselves. It's not something we learned in school. In many parts of the world now, it's part of the healthcare professional curriculum, whether it's nursing school, medical school, physiotherapy, pharmacy, it's become part of the curriculum. So they don't know any different. They do a lot of these things automatically. We are not yet there. And so we're having to invest in it. But that investment pays off. It pays off, you know, when you do it, it pays off because your staff are happier, your clients are happier, you get more footfalls, you get you're less risky. There's less risk of litigation because our people are wise enough. Yeah. You know, litigation, we're getting litigation more and more, you know, especially for the higher brow organizations. So yeah. So I mean, that's what I would say to a CEO or a leader of a healthcare organization.
This is great. Thank you. Just to recap, you know, what you've said, it's really, I guess it all starts with the mind. So it's a mindset shift, right? You know, even if you may not have the resources, you may or you may not, but it's just starting with the fact that you want to change, you want to improve care delivery within your facility,
the will.
Organization. The will, exactly. Where there's a will, there's a way, right? So that's very, very important. And just the fact that you're even listening to this webinar shows that you have some interest, you know, in hoping and, you know, seeing change happen in care delivery. Of course, as she also mentioned, accountability is key. And as she said before, everybody is a leader. So thank you. That was a segue, but I'm going to move on to our next question. So you have done extensive work in improving clinical governance in some very well-known hospitals in Nigeria, as you've mentioned. Can you speak more in depth about that process? And what are some of the most common challenges that healthcare leaders face as it relates to governing for quality in this part of the world? So I think you talked a little bit about that, establishing standards or processes rather. I don't know if there's anything you want to add to that.
In terms of the process for improving clinical governance,
yes.
Well, I guess really that's it, So first of all, it's the leader having a vision, right? To say this is what we're going to do. Like I said, Professor Ajibike was bang on. I say he was a man before his time. You have a vision, you communicate that vision. So that's one of the very key things. Communicate enough for your people to actually even begin to think that this vision is ours. They begin to own it with you and they run with you, right? Even where there are difficulties, because it's a core vision for everybody else, we find a way to get over it. Then, of course, establishing those standards and establishing the way of doing things. So if I remember, I recall our in Lagoon, things like every Thursday we had a clinical session where we could discuss different things, from clinical subjects to non-clinical subjects to looking at our data, what's happening here, what's happening there, discussing difficult cases, the willingness to give the people time to be educated and to educate themselves is, it was really part of it. Of course, the willingness to commit the resources. And of course, when we're talking about resources, we're talking about time, the people, committing the people to it, materials. You may need to get some materials, if need be. It's not always the case. Then some of the other challenges I remember we faced was staff retention. Not because the organization is bad, but because the organization was so good that the staff were being poached. It was other organizations were coming after the staff, and so we had this problem of having to train and retrain and retrain. And I can tell you it's not easy. But I remember the current CEO, Dr. Kogabi, the CMD, at some point saying, he had to at some point stop being so angry and saying to himself, I will see this as a community responsibility. So I'm training healthcare people who are going out, training people to deliver good quality, and then they go into other places and they go and deliver. So, okay, so we're doing this for our people, right? Mm-hmm. So those are some of the challenges. Of course, the regulatory environment is a challenge. Let's put it that way, or the lack of it. If you're a hospital that's committed to delivering quality, you're operating in the same environment with organizations that are not really willing to make that investment. And so it sometimes makes it a bit difficult for you to price competitively. So, but it would take some careful planning, improving efficiencies to help you manage your costs in such a way that you don't price yourself out of the market. But that's a reality that you would have to deal with, right? Yeah. So, I mean, those are some of the main challenges. Staffing, again, you'd have to consider, because I remember many times, people would come into the organization and you say, oh, this is the way we do it. It's very different from the way they've never worked that way. And the first thing is like, oh my goodness, this is too much work. Oh, well, that's because you've not been doing enough work where you're coming from, or not doing it right. So it's you have to be very, very deliberate about inculcating that culture into the new people that come. Otherwise, they dilute your culture. And before you know what's happening, they destroy the culture. So those are some of the things that we actually have to pay attention to. I remember in Lagoon, we had that up and down for a while till you began to see that, look, one of the most important phases of an employee is the induction phase, when they come in, the onboarding phase, where you get them used to it. If you don't do it correctly, then you're in trouble.
It's very true.
Because they come in with whatever it is they're coming from outside with, and they begin to erode the culture that you've worked very hard to build.
Very true. So, I think it goes back to even what you said about a culture of excellence, right? If you embed that as soon as they get there and they know that this is the standard, it's not the exception. This is how we always operate. I think, like you said, that's very, very important. So I'm sorry, I think I might have cut you off.
No. So that's it really. Managing the regulatory environment, we would have to, I wish, because that is part of the cost. The cost of delivering care is high. I wish we could have more advocacy for healthcare. The cost of procuring, we hardly manufacture anything here. And the import taxes on healthcare is just almost as high as everything else. So it makes it a bit difficult and challenging. But like we said, we need the will. So maybe we need a stronger will than places where the environment is easier, right? We need to build stronger will, but we must. We again, the alternative doesn't bear thinking about.
Yeah. I agree. And I think, you've raised a very good point as well. When we think outside of healthcare, right, we think the political will is very, very important. And I think 2020 showed us that, especially living in a country like Nigeria, sometimes there's no opportunity to run away, that you have to actually fix the problems that are happening at home. And we had a webinar, maybe sometime in July, I think, where they talked about, manufacturing PPE and all those things, that we can actually do that here, right? Because like you said, the cost of importing and all of those things are sometimes it's astronomical and sometimes it's not available, as we saw, right when COVID happened, where everyone was scrambling, right? So it's building up those skill sets at home. And you touched on something before I move to the next question that a lot of our participants say, or owners of hospitals say, is that, I train, my staff, and then they're poached or they leave. And I'm really happy that you said that, because I'm sure somebody that's listening is thinking the same thing. So I train my staff member and now they go. And maybe there's nothing that you can do, or maybe there's a few things that you can do to mitigate that. But it's also about a mindset shift, like you said as well, because maybe this hospital that they've gone to, maybe one of your family members will go there, right? So looking at it as we're building up the community and we're building up the resources and the skill set of healthcare providers, so that eventually it's not, only go to this hospital, but it's most of these hospitals are great, right? So I think that was, sorry, go ahead.
Yeah, and maybe it's time even those who are a bit more aware and committed to quality step out of their perimeter, and we begin to think about, how do we begin to influence the medical schools? Let's step away from ourselves. We're all suffering this. So what do we need to do, even though it may be a longer term solution? But what do we need to do to get almost everybody trained that way, so that when I then train my staff, if everybody, or if there's a minimum good standard, then so how do we begin to influence the medical community? How do we begin to influence pre-service training, right? Such that we can get better staff, stronger staff, and we're not just a few islands, spots of excellence. We want excellence across the entire healthcare system, right? So what can we do? Let's step out of our private hospital walls and move forward and see what we can do to influence the whole environment.
I agree. I agree. That's a excellent point. Is not just thinking about it from, like you said, from our own organization or facility, but system wide, as you've really talked about. How do we start from the medical school down, or up rather, to ensure that quality is embedded everywhere. So I want to move to the next question, and it is this. So, in your expert opinion, what are some of the critical skills that leaders need, in order to effectively govern for quality?
Okay, so there are a few things I can think of. One of the ones that I think is most important is even knowing, having the knowledge of what quality and safety is. Leaders have to educate themselves. They have to take courses. They have to understand what this is. If you're leading a people and you don't even understand where you're leading them to, they're not going to follow you, or everybody just goes down the wrong path, right? So leaders have to be willing to educate themselves, acquire knowledge of this thing we're calling quality and safety. Then you can lead, right? Secondly, they have to develop their leadership skills. I know it sounds very like, oh, okay, that's what we all say. But leaders actually have to develop their leadership skills. Some people are born leaders, but I can bet that that's 5% or less. Everybody else has to develop the skills. So you have to invest in yourself to develop it. Get to know yourselves. There are all kinds of beautiful free tools out there. The NHS has this really lovely leadership competency framework and assessment tool that I love and I've been sharing with people. Know yourself, because to be able to lead, you must have qualities that make people want to follow you. You must be able to draw people. You must be able to speak to them. Your purpose has to be clear to your people. So if you don't develop your leadership skills, and then to even bring about change, you have to be willing, you must be able to get people to see why that change is important. And if you're not able to do that, then it's not going to happen. You also must have very good communication skills. Really, in fact, I think it's one of the really key skills. You must have excellent communication skills to be able to communicate your vision, to be able to talk to people, to be able to hear them. So good communication. And when I talk about that, I'm talking about not just talking, listening, right? You must have good listening skills. You must be able to hear what's said and what has not been said, what is being communicated to you, right? You have to have really good listening skills. You must have humility and be willing to be vulnerable as a leader. You must be able to acknowledge that you don't know everything. You do not know everything. And be willing to accept that sometimes that frontline person, that person who is sitting at the front desk, that junior doctor, that nurse, that, they know more than you in a particular situation. And you must be able to cede leadership to them at that point, that situational leadership. You must be willing to do that as a leader. So, being emotionally intelligent enough to know that at this point I need to get somebody else. And you must be willing to be vulnerable. Vulnerable, not in a terrible way, but open to let your people know that I'm human too. And I am not, I'm not a god. I don't know it all. So you invite people in. They see you as human. They're more willing to interact with you. They trust you more. Being able to be vulnerable actually engenders trust. And when you have that trust, you find out that, in fact, your staff do not necessarily go away, because it's not all about the money. Even though people, yes, you must have money to survive. But you find out that people, they go and then they come back because they know that, this is where to be. They trust you, Then you must be willing to be adaptive, right? They talk about adaptive leadership skills. You must understand that healthcare is complex. Oh my goodness. healthcare is complex. And when you have complex systems, the simple and complicated solutions, the technical solutions are not, very rarely answer the problem. You find out that oftentimes what you think is a solution becomes a problem down the line, and that there's a whole lot more to problems than just a simple fix. So when you see someone saying, oh, yes, we have a problem, boom, they have the answer. It's not always like that. So as a leader, you must be willing to adapt. You must be willing to flex. You must be resilient. One of the things, one of the examples that comes to me is this drive to establish many hospitals to establish EMR. I'm one of the people that's a bit skeptical about EMR. Not because EMR is not good, it is really good. In the environment in which we're working, we need to think about it, right? You establish EMR and you want to go paperless. Fantastic vision. But are you able to keep paying for the hardware? I am not sure how many organizations can provide all the hardware that's needed. If you don't provide that hardware, you don't have enough. Your staff are having to queue to use the computers. Then they forget things and then errors happen. And you're still insisting that, no, I'm going fully EMR. We have to be flexible. You need to adapt.
Yes.
As a leader, you need to be able to stay at 5,000 feet while being on the ground, see what's happening. You must have that ability to go high and go low, see everything from the system level and yet see it on the ground level. So that's part of the adaptability that you have to have. Yeah.
This is great. So a leader has vision. A leader is able to communicate their idea well enough that people buy into it and they now feel that they're a part of the vision. A leader is willing to give people space to grow and to commit their resources so that they can grow. A leader, is vulnerable, which I really, really like, especially in this part of the world where I don't want to just say medicine, but there's always this like big man, I know best and you guys do what I've said, right? But that doesn't necessarily inspire people to actually buy into what you do, right? Now you just have, for lack of a better word, a bunch of minions that do as you say, but don't necessarily understand or haven't necessarily bought into why we're actually doing this, right? So one wrong thing and they're back to their old behaviors, or one wrong influence and they're back. So that vulnerability, I think, is really, really key. And then, of course, to be adaptive and resilient. So I hope everyone has taken notes, or you will take notes. This is what a leader looks like. So on to our next question before we wrap up shortly. Ensuring effective systems and processes is a key part of improving quality care delivery. Can you provide some examples and speak more about what that looks like on a day-to-day basis?
I'm not sure I fully understand that question.
Sure.
Can you break it down?
Sure. So ensuring effective systems and processes. So I think somewhat about maybe going back to what we said about, having standards, right? So for example, let's just say before we operate on a patient, we now know that we have a checklist. We now know that, the patient has to verify, this is what we're doing, right? So we put some systems and processes in place to ensure that we're improving service delivery. Can you provide, so I think I've just provided the examples. Can you provide some examples and speak more about what that looks like on a day-to-day basis? So I think I've given the examples, but more so, how does that look as you are a leader trying to ensure that these things happen?
Okay. So effective, efficient systems, usually have to be standardized. I know that, many clinicians kick against standardization. They're like, oh, my patients are different, but not necessarily so. 80% of patients or more, 80% of situations will fit into a standard, because the standards are built based on, oftentimes based on research and evidence. So to have effective standards, effective systems, you need to standardize. And when you standardize, so we need to make sure that things are written down. So that's why you have policies. That's why you have written processes. That's why you have protocols. Not because anybody is not smart, but because you want to reduce variation. You want to make it easier for people to do the right thing. So we must remember that, people can't keep everything in their heads, even though they're trying to do the best. So at the point at which, if there's nothing written, nothing to guide them, they will take what they think is the best decision at that moment. If there's no structure, no guidelines, nothing. And so when we talk about people, organizations making sure that they write out their policies, write out their processes, it doesn't matter who leaves or who comes. We're able to maintain the service level that we want to have. So having a good admission process that says, step one, who does it? This is what is done, who does it, and when is part of it, right? If we have standards, so you talked about the surgical safety checklist. That's an effective system that says you give your antibiotics, you stop, you check, you have set that standard in place, right? Clinical guidelines do the same thing. Step one, do this. Step two, do that. Those are very important. Of course, monitoring your systems also helps you to be effective. If you don't monitor your systems, you don't know how they work. So on a day-to-day basis, that's it, really. This is the way it is done. Of course, you allow for flexibility. That's part of the trust. That's part of building a culture of quality where people know that they can step out of the standard with good reason, right? But they know that there is a reason. Somebody will ask you why you did it, but you can explain it. You can explain why you did it, and usually it's with good reason for the patient's sake. So setting standards, I think, is key. Of course, you can adopt standards, and you can actually build your own standards, but it's best to make sure that you do them based on evidence. So don't build standards out of thin air.
Yes.
And there's evidence for just about everything nowadays. So if you're going to build your own standards, then build them based on evidence of what works and what doesn't work. And then don't try to reinvent the wheel. There's a lot that has been done out there. Find what works and then customize it for your own context, right? Adapt it for your own context. I'm not sure if that answers your question, really.
No, very much does. So just to recap, we've talked about their different, checklists, policies, procedures. What's really, really important is ensuring that, everyone has access to these things. So make sure it's written down. It could be on a flyer, on a board, where it's very easily accessible. So there's minimal variation, as you said. But of course, we allow for, an exceptional or, exceptions to the rule, because not everything fits into this box. But for the most part, everyone is held accountable to those standards that have been evidence-based and have been set. So thank you. Yes, you did answer the question. And this is our last question, unfortunately. As many of us have heard, if you can't measure it, you can't manage it. Please speak to the importance of proper data collection and why is it an important part of providing quality healthcare services?
Okay. Data. I love data. As the saying goes, I don't know who it is, but I have adopted it as my own. In God we trust, every other person brings data. If you're going to talk to me about anything, you bring the data. You show to me. You need to show me that it's it's working.
Yeah.
Right? So, I mean, even data collection is part of the effective system. If you want to be effective, you need to know how you're doing. The natural tendency that everybody has is to assume that they're doing well. It's very difficult for you to stop and say, I am not doing well. Right? But you need to know. If you don't know, then you can't do anything about it. It's like saying, you know, if you don't have, all of us use Google Maps and you want to go someplace. If you don't have a starting point, if you don't allow Google Maps to determine your starting point, it can't give you direction.
That's
you
right.
can't move. So measurement is that starting point, is understanding how am I doing objectively. How am I doing? Because I need to know, and then I need to know where I'm going. And the other thing is, as you even make changes, you need to be sure that the changes that you're making for improvement are actually bringing about an improvement. Because every improvement requires a change. You know, if you're going to do things better, you need to change something. But not every change is an improvement. You can make changes even with the best intentions, and it makes things worse. Or if you're lucky, it doesn't do anything to your system, but it can actually make things worse. So you must be willing to collect that data to understand where you are and to understand how you are doing. But like you said, you must collect the right data. You must, again, it's part of the vulnerability. You must be willing to be open to say, how are we doing? Because you can make data say anything. Oh my goodness, give me data. I will interpret it for you. And I'm not lying. Because you can really make data say different things, depending on the way you analyze it and what you do with it, right? So you need to collect the right data. If you want to know, if for instance, something we all are struggling with now, you're struggling with your weight. If you're struggling with your weight, and you want to know whether you're losing weight, and you start measuring your height, and you're feeling like, okay, at least I'm not gaining weight, so I can keep eating the chocolates, and then you're measuring your height. Oh, it's okay, let's keep going. And my weight is not changing, I'm doing well. Then it takes you down the wrong path. So being able to define clearly what it is you want to measure, finding the right measures that are actually effectively determining what it is you're doing, right? And then having the right measures in terms of outcome measures, process measures, because like we said, to get an improvement, you need to make a change. So if you are not making the change, then you can tell that you are not going to get that improvement. So being able to know that I am making the changes consistently, which will get me to the outcome that I want, is important, right? And then in healthcare, we should measure a broad spectrum. We're not just measuring the clinical outcomes. We need to look at our processes. We need to look at our structures, right? Your facilities, you need to be looking at how often are we getting these accidents? Are we getting falls? Are repairs done on time? Is the admission process working the way it should work? Don't just focus on clinical outcomes, because you'll be surprised how even the non-clinical processes and the process of delivering the care actually impact on the outcomes. Then, we talk about joy at work. We can't but talk about, how your staff feel, right? So in healthcare, you want to improve the health of the population, you want to improve the patient's experience, you want to try to deliver the best quality care at the best possible cost. But you must think about the people who are delivering this care. Are they fine? Are they okay? What do we need to do? Because when people are joyful at work, they tend to do much better. The patients get the best of them. The processes, they work better. They're thinking sharp. They're working to improve the process. They're engaged. So I want to plug that in, that employers should please think about how do we make our environments joyful for our staff, because you will get the best of them when they are happy.
Thank you. Thank you. Thank you. Thank you for saying that. A lot of people, especially in the patient-centered care program, a lot of staff would mention, we do all this work, but no one really thinks about us in the process. And you raised a very, very key point, which is, making sure that your staff, are joyful, are happy. What are those things that you can measure to see? And not only after you've done the measurement, now how can you use that data to improve their experience at work? So, aside from that, you said a lot of golden nuggets. Collecting the right data. Collecting data first, as we've agreed, is very, very important. But it's not just collecting data, because like you said, you can make data say anything, right? So collecting the right data so that you now know how to use that data to ensure that you have the right outcomes. And when thinking about working in a hospital setting or a clinical setting, collecting data that is related to care delivery as a whole. So not just, the clinical data is important, but all of the, various aspects. Maybe how long did they have to wait to get a follow-up appointment? Or, are the rooms too warm? Certain things that are just actually very, very important in shaping the overall experience of the patient is important as well. So Dr. Ajibike, this was it wasn't an interview, it was a wonderful conversation. I really enjoyed it.
Sorry, a couple of things more about data, because we realize that a lot of organizations have data, but they don't analyze the data and use that data for decision making. Trust your data, clean it up properly. And I'm not talking about tampering with data. Then even understanding how to interpret data. So there's data for accountability, there's data for research, and there's data for improvement. You don't look at all that data the same way. So if you're going to start using data, I would suggest that you find, because there are all kinds of beautiful things on YouTube now. YouTube has everything that you want. There are lovely books. Understand how to analyze your data so that you're getting the right information from the data, and then use it for decision making. It's no use, we see a lot of organizations that have a lot of the data rich, but information poor, right? So please, I ask everyone, think about how you want to use your data and actually begin to use it for decision making.
That's very key as well. So maybe just to piggyback on that, when you know how you want to use your data, that informs the kind of data you will collect, correct? Okay. Yeah. Okay. So this is great. Data for decision making is something, in leadership and management, and especially in healthcare, is very, very important. So I completely support that, and I completely agree. So to wrap up, we've spoken about a lot of different things, but all related to quality improvement and, of course, clinical governance. So we talked a bit about, ensuring what clinical governance is. We talked about how it's accountability, how it also has to do with leadership. And when we hone down on accountability, we realize that everyone is a part of the system. Everyone is a leader in their own respective sphere of influence, and everyone contributes to ensuring that the system works and the system is efficient. We also talked about making sure that we don't have a punitive culture, but a culture that there's no failures, they're just lessons, right? So how do we learn from this experience? And of course, there will be some bad apples, as we said, but for the most part, it's usually when something goes wrong, it's usually about the system and less so the person. We talked about what a leader is. So we talked about leaders are, they're visionary, they communicate well, they get people to buy into this idea and take ownership, and they're vulnerable, which is very, very key in this part of the world as well. We talked about data, and data, this is a fantastic place to end. Data is really important. So you're watching this, I'm sure, because you are passionate about, moving your hospital, your facility, your organization to the next level. But you can't do that if you don't know where you're starting from. So as Dr. Ajibike has so wonderfully said, you know, first of all, know the data that you're collecting. What kind of data are you looking for? And use that to guide as you try to mine for this data or source for this data and collect it. And of course, you have to analyze it, right? So after you analyze it, what do? You use it now to make informed decision making. Mm-hmm. So Dr. Ajibike, thank you so much for a wonderful, wonderful conversation. I just want to give you a minute to tell us where we can find out more information about you, more information about your organization, if anybody is interested. So I would, I'll hand you the floor.
Okay. So right now, there's not very much about my organization out. I'm just setting up my website, setting up, all that. But you can reach out to me on LinkedIn. I am on LinkedIn, so my personal page is still on LinkedIn. My company is not yet there. So please do feel free to reach out to me on LinkedIn. And my email address is jbyke and the number 2000 as one word @yahoo.com. Feel free to drop me a line if you have any questions. But I guess right now, LinkedIn seems to be the best place to find me. Yes. Thank you.
Wonderful. Thank you. And as I've mentioned before, Dr. Ajibike also supports some of the work that we do at the HLA. So you may see her from time to time as a faculty member. So please look out for her there as well. But Dr. Ajibike, thank you. For those of you that want to share this link, please go to our website, www.hlaafrica.org. Dr. Ajibike, thank you so much for your time and for a wonderful, wonderful conversation.
Thank you, Annalie. It's been great sharing my experience. Always lovely speaking with you anyways.
Thank you.
And thanks, it's been great being a part of HLA as well.
Thank you. Thank you.
Thank you. All right.